Okay, so the first special test I'm going to do is the Lachman's test. So I'm going to move your leg just to the side of the table and I'm going to pin it there with my leg. About 30 degrees of flexion. Just relax your hamstrings, good. And then what I'm going to do, I'm just going to add a loading and then unloading of the knee joint, checking how much laxity there is anteriorly, especially, also posteriorly. Now compare bilaterally to determine if that laxity was normal on both sides. What I'm going to do is a pivot shift test determining an ACL tear. So what I'm going to do, keep the knee in full extension. I'm going to support the weight of the leg, put my hands around the calf, resting on the tibia so that I can apply an axial force on the tibia. So I'm going to apply that axial force. I'm going to slightly internally rotate and push so there's a valgus force when I flex the knee. And I'm looking for, when I flex the knee, any subluxation of the tibia on the femur, any anterior subluxation. There we go. Okay, so the next test I'm going to do, so I didn't notice any subluxation or relocation of the tibia during that movement, so it doesn't look like you have an ACL tear. The next test I'm going to do is valgus stress test. So I'm going to keep the leg in extension. I'm going to use my control hand, and this is kind of a resting hand, to apply valgus force on the knee to determine the integrity of the MCL. And I compare it bilaterally to test laxity side to side. So there's no real opening of the joint at 0 degrees. I'm going to add slight flexion, so it's about 30 degrees of flexion. Once again, controlling with the valgus force with my bottom hand and just supporting with this upper hand. Now adding a slight valgus force. Remembering to load and unload the joint. So there's slight opening of the joint, and I compare it bilaterally to see if that's normal for the person.